First of all, pathology, most of the people think that pathology is just about the blood and urine examination. I would like to clarify this very particular point at this very level. Pathology is not only about blood examination or urine examination, it is more vast than we can think of. As a specialist, I see routine investigations of the patient, clinical biochemistry, then hematology. I perform FNACs, that is the fine needle aspiration cytology of the patient, of the swellings and the lesions. I see biopsy slides of the patient, pap smears, and the main purpose is basically to rule out a malignancy. Let me clarify the students at this very point that taking medicine and going to be a doctor of in any branch in rather, being a physician, being a pediatrician, being a surgeon, see, your life will be the most hectic of others, ever you can think of all the people, your life will be the most hectic one. But still, being a pathologist, it's it's like I am relieved a bit, and I don't have night duties after being a consultant. During residency period, you do have your night duties, but right now I don't have night duties and all, and so I can easily look after my family. See, in India, there is a lot of scope right now. You can start your own venture any day. After completing your MD pathology, you can start your own venture and become your own boss. One can also work in a reputed medical college or a reputed hospital. Abroad also, you have a lot of options. You can clear the USMLE and go to the US, or you can join any hospital, medical colleges abroad, or get into research. So basically, pathology is a upcoming. It's like everyday researches are going on, and molecular pathology is the latest thing.
The few questions which I need to kind of ask you.
First of all, MD pathology is one of the best branches to pursue for post-graduation level. One should pick up pathology as it helps one to lead an independent life. It involves around all the intricacies of medicine, and most importantly, there is a thrill of diagnosis. The eureka moment when the diagnosis is found is totally because of the pathologist. If we make a diagnosis, then it is like the confirmed. Biopsy is the confirmatory diagnosis for each and every disease. So in that way, it helps other doctors to assess the patient again. If we have made a diagnosis, they'll reassess the patient again on the basis of that diagnosis and then treat the patient. So
Great.
And make the patient healthy. Yeah. Students, all the subjects basically during MBBS curriculum are important in some or the other way. They all are linked, co-linked at very minute level, at the large level, at every level basically. But to specify, I think medicine, in order to be a good pathologist, you need to study anatomy, physiology, biochemistry, and microbiology thoroughly to be a good pathologist. See, in the case of forensic pathology, it is mainly about autopsy. Autopsy, you must have heard about. It's the post-mortem thing. But the forensic FMT people, the people who have done MD for FMT, they are performing it in cases of medical legal aspects. But a pathologist is doing it for the interest to make the diagnosis, not on the legal grounds, but the other grounds. So autopsy pathology is also an important thing, and FMT for that matter is also important. But if you have interest, you can go for autopsy pathology as well. Yeah. In the case of if you are employed somewhere in India or rather abroad, then you may someday or the other have to perform an autopsy pathology of the specimen. It might be any specimen for that matter, and it has certain guidelines for it, and you might encounter that as well. Yeah. Students, first of all, if you are opting or thinking of being a doctor, then you must understand 2 or 3 things very precisely and very importantly. It should go into your brain. First of all, you will be the Matlab, you'll always be under stress, any kind of stress. You will have to manage how should I manage my family life, how should I manage my professional life. There are so many things. You'll always have to be at your toes, I would say. And then any branch, if you go for any branch rather, just be loyal and be courteous. First of all, if you take any branch you're opting for, then uh, nowadays a lot of coax are over there, and lot of business marketing is going on in the field of doctors as well. So be loyal at least. Be loyal to your patient. Be loyal to do justification to whichever branch you're opting, and then also be courteous to each and every patient and each and every colleague, every human being. That's it. As I've told that one can join as a pathologist, as a consultant pathologist. See, first after completing your MD, there is a period of senior residency for 3 years, and after completing senior residency, one becomes a consultant. Then you can join any good hospital, any laboratory. You can open your own venture, any medical college you can go for. So there are a lot of options in both the government sector as well as the private. See, working in
Great.
a medical college, I think, is the best thing. If one has to choose both, if one has to be updated, because being in a medical college, you have a lot of platform. You have students of MBBS, second year MBBS, and if it is a postgraduate medical college, then you have MD students. You can teach them. They have a lot of queries. You can answer them. You can help them in their thesis. That is the academic thing. Then there are a lot of researches going on. The MD people are doing their thesis. So it is the best platform to join anything. Then there is the best library. Medical colleges always have the best library. You have the best books, best journals, everything. So I think the medical college is one of the best amongst them. See, it is better always if you have completed your MD, you just be there in your own parental college, from the college which you have finished your MD. You do senior residency from that particular medical college, and then you can freely join any institution or anything. I think one should do senior residency from his or her own parental college. See, the day I opted pathology, first of all, I it was clarified in my mind by the end of my NEET exam that I don't want to be a pediatrician or a physician. Rather, I want to be a pathologist. The day that was clear in my mind, and I entered the MD pathology, it was easier because it was very much clear in my mind. Then reading on, you develop the interest, and that's it. Seeing the cases, the interest gradually keeps on increasing, and that's it. Then I had an interest for the pathology. See, I would like to, most of the people are still thinking that pathology is like sitting on a chair and reporting your slides and nothing else. It's like the most easiest branch. Most of the people might be thinking that. It's, it's not that easy also. You just have to, whichever branch you're choosing, no matter whatever branch it is, but you just have to be consistent. I would like to say the word consistent. You just have to be consistent throughout your medical school, medical career, whatever. See, each day, each and every day is a learning process. Each and every second is a learning process. You might encounter so many cases, and you might go blind as well ki what is this happening. You might go blank as well ki what is this happening, ये कौन सा case है, मैंने तो कभी नहीं देखा. मतलब you might go high on your nerves, but then be calm, composed, and read all your books and go to all your colleagues, consult your colleagues, and then when you arrive at the diagnosis or the patient says that I am glad you have treated me well, that is the best moment. You might be reading Robbins. I think Robbins is the basic book and the best book ever. If you are thoroughly consistent with the Robbins, you know each and every thing given in the Robbins, that is, I think, more than enough. If you have any Robbins में अगर आपको कुछ नहीं समझ में आता, कुछ doubt होता है, then you might open any other book. There are a lot of books actually we are reading in MD, but at the UG level, at the undergraduate level, Robbins is the only book. I think you need to be thorough with it. See, if I am stuck, if I am going through, if I am seeing all the cases similar types, If I'm reporting hematology slides, that is, hematology is like the bread and butter of pathology. I'm well versed with it, so I'm not referring my books or my notes for it. But if I'm stuck in a particular case, if I'm stuck in a case which I have never come across, then definitely I have to refer to my books, my notes, and everything. As if you're talking or if you're picking a medicine branch, any branch rather, and at even any branch, it will never be a stable field. Every day you will have to see a lot of different patients, different cases. कुछ भी आप कोई सी भी ब्रांच चुनेंगे, एनाटॉमी, फिजियोलॉजी, बायोकेमिस्ट्री, कुछ भी लेंगे, वो कभी भी स्टेबल नहीं होगी, क्योंकि ये साइंस है, एंड साइंस आल्सो यू नो इज डे बाय, मतलब एवरी सेकंड एवरी डे इट इज, द रिसर्च इज कीप ऑन गोइंग ऑन, एंड the it can't be a stable field. Then the next question is how do you keep up with the use of advanced equipments in handling patients? As I told you, life, see, it's a learning process. Till date, many equipments, many machines are coming in the market. I don't know how to handle. Maybe some of them I know and some of them I don't know. Then I learn. I attend seminars or I go to workshops. I go to the direct, and then I learn about handling them, the equipments. I learn about their handling, and then definitely we'd make a diagnosis and treat the patient. Then MD pathology is of 3 years.
Yeah. So traditionally,
any MD, any specialization is of 3 years. See, financially there is no limit. If you open your own set, during the initial days, matlab, after completing your MD, definitely you can't just open your setup. It's not possible. After completing your MD, you need to study. Then also you need to do residency and do work at a good places if you find. And then after that, if when you think you are competent enough or you are capable enough of opening your own venture, you can get into your opening your own venture, and then there's the limit. Most of the patients which we come across, they don't they don't acknowledge you. They think that being a pathologist, he's not a doctor as if. He's sitting at the back side of the door. It's like behind the, you understand, behind the screen, as if being a pathologist, you're not directly interacting with the patient. I think this is the this is the disadvantage, the biggest disadvantage, that you are not directly interacting with the patient. The clinician is sending the sample and then you're just processing it, or your technicians are processing it. And if you're doing FNACs or biopsies are also coming directly, so you're not directly connected to the patient. So patient को कभी पता नहीं चलता कि पैथोलॉजिस्ट का भी रोल है उसके इलाज में या उसकी डायग्नोसिस में. इज जस्ट दैट कि मतलब रिपोर्ट आ गई, ठीक है, ही नेवर नोज कि वो एक डॉक्टर ने एग्जामिन किया रिपोर्ट, वो डॉक्टर ने देखा उसका सैंपल. दिस इज द बिगेस्ट डिसएडवांटेज, दैट लेटर ऑन आफ्टर बीइंग पैथोलॉजिस्ट यू थिंक दैट कि मुझे, जैसे होता है ना हर किसी को कि अरे मेरा पेशेंट, तो देयर इज नथिंग लाइक मेरा पेशेंट. Post MD, you can go for DM. You can do DM hematology, DM oncology. Presently, I think DM hematology and DM oncology is only there. And Tata Memorial Mumbai is also, they are offering a lot of you can go for fellowships, the 1-year postdoctoral fellowships one can go for. Or DM is a rather competitive one. So you have to again clear the exams and go for. Then it's like the field of vision, or rather your field will be restricted. You can do DM and neuropathology. Then you just have to see the brain neuro slides throughout your life. Only the neurology cases, only the neuropathology slides. So in that sense, if you just want to see everything, then I think it's better to see everything. अगर आपको restrict हो जाना है तो आप DM करके आप neuropathology देख रहे हैं, या आप liver की slides, liver and there is DM in liver pathology also, hepatobiliary pathology. So that is the thing. Being a radiologist, having completed your MD in radiology, you just have to see the ultrasounds, X-rays, MRI, CT scans. That is the imaging part. But being a pathologist, I'm doing FNACs. That is the FNACs of the lesions which are palpable, like which I can feel. I am doing a procedure on them, and it's see, radiology and pathology are totally different. They don't have any connection, although. And in pathology, as I've told, I'm doing FNACs, biopsies, then pap smears I'm seeing, and then blood slides also I told. Yeah, sure. As I told, presently there are the researches are going on in the field of molecular pathology. That is at the level of genetic, at the gene level or at the DNA level, we discover why a particular disease occurred in a patient, in a particular person. Then, vaccines are, if for example, HIV or any other illnesses, in which case we want to prevent the disease. The research is going on in the case of how to develop a vaccine against a particular disease. That is it. See, if you actually, I would मतलब say कि मतलब हर किसी में ना एक जज्बा होना चाहिए हर ब्रांच को लेके. ग्रेजुअली जैसे जैसे आप करते जाते हैं ना, वो आपके अंदर वो जज्बा आता जाता है. जो से विच एवर यू ब्रांच यू चूज, you have a particular kind of inclination or an high kind of interest into it. I think if one wants to have a work-life balance or have a personal life on their own rather, then they should choose pathology, number one. Then radiology is also a good branch. Then dermatology is also, being a physician. All these branches I think are the best among. See, if one is posting a patient for a surgery, for a particular surgery, if it is an elective procedure, if one is posting, then there's a PAC, pre-anesthetic checkup. At that level, the anesthetist assess which drugs he can administer and all. Then when the patient has to go through a lot of tests, maybe complete blood count or LFT, KFT, all these things are being done in the pathology lab. First point. Next point, if for example, if there is a lesion, if there is some lesion over any part of body, and if the surgeon is planning to undertake the patient for a surgery, then he has to assess whether the lesion is benign. Benign means it is not going to, I think the students might be knowing the difference between benign and malignant. Even before the surgeon is undertaking the surgery, he needs the report from the pathologist that whether the lesion is benign or malignant. If it is malignant, the surgery will totally be a different one. He has to take the margins, and he has to do the surgery in such a way that he is not spilling the tumor. Understood? And if the lesion is benign, then he'll do the surgery in a totally different manner. See, being a microbiologist, if you have completed your MD microbiology, then you have to continuously see only the microbes. You have to see the any microbe you might be encountering, Salmonella typhi or any microbe. I think students are well versed with all of them. So being a microbiologist, you are just seeing bacteria, viruses, and then parasites. But pathology is a totally different thing. आपको जो मतलब जो भी any swelling if a patient is having on his body, आप उसको evaluate करोगे. ये क्यों हुई patient को? Why did the patient had it? What is it? Is it a cancer or is it benign? What are the chances patient further? Is it precancerous? Patient later on patient might have cancer. So pathology is a totally wider sense of experience rather than microbiology. Microbiology is just about studying microbes, about bacteria, viruses, parasites, culture, everything.